Welcome to our video on carpal tunnel syndrome, CTS. In this video, we delve into the etiology, symptoms, diagnosis, and treatment options for carpal tunnel syndrome. We will highlight the importance of the team-based approach, showcasing how different healthcare professionals work together to effectively assess and manage this condition. Join us to learn more about carpal tunnel syndromes and the collaborative efforts that ensure comprehensive care for patients. Carpal tunnel syndrome is the most common focal mononeuropathy, accounting for 90% of all neuropathy cases. Carpal tunnel syndrome occurs when the median nerve is compressed as it passes through the carpal tunnel. The primary factor contributing to carpal tunnel syndrome is increased pressure within the carpal tunnel. The initial symptoms typically include pain, numbness, and paresthesia, affecting the first 3 digits and the lateral half of the 4th digit. Carpal tunnel syndrome symptoms can vary, with pain presenting in the wrist, the entire hand, and potentially radiating up to the forearm or beyond the elbow. Pain associated with carpal tunnel syndromes generally does not extend to the neck. As the condition progresses, individuals may experience hand weakness, reduced fine motor coordination, clumsiness, and eventually atrophy of the thinner muscle. Initially, carpal tunnel syndrome symptoms often appear at the night while lying down and tend to improve during the day, especially during repetitive activities such as drawing, typing, or playing video games. In advanced stages, these symptoms may become persistent or constant. Occupations involving frequent computer use, exposure to vibrating equipment, or repetitive movements significantly increase the risk of developing carpal tunnel syndrome. Obesity, genetic predisposition, diabetes, rheumatoid arthritis, hypothyroidism, and pregnancy also contribute to the risk. The carpal bones are a group of 8 small bones that make up the wrist in humans. These bones are arranged in 2 rows. The proximal row closer to the forearm and the distal row closer to the hand. Proximal row, scaphoid, lunate, tragatrium, pisiform. Distal row, trapezium, trapezoid, capitate, and hamate. Articulations and function. The carpal bones articulate with each other and with the radius and ulna proximally, and with the metacarpal bones distally. These articulations allow for the complex movements of the wrist and hand. The carpal tunnel is a narrow passageway in the wrist that is bounded by the carpal bones on the dorsal and lateral sides and the transverse carpal ligament, also known as the flexor retinaculum, on the volar palmar side. It serves as a channel for the median nerve and the flexor tendons of the fingers. Muscles, tendons, and nerve passing beneath the flexor retinaculum are 4 flexor digitorum superficialis, 4 flexor digitorum profundus, flexor pollicis longus, and median nerve. Common clinical physical tests for carpal tunnel syndromes are Fallon test, Tinel sign test, and Durkheim test. Fallon test involves when the practitioner asks to the patient pressing the dorsal surface of their hands together for 30 to 60 seconds, which increase pressure on the median nerve by compressing it between the flexor retinaculum and the distal radius. The test is considered positive if the patient experiences symptoms typical of carpal tunnel syndrome, such as paresthesia. Another sign of CTS is positive Tinel sign, where tapping the median nerve proximal to the flexor retinaculum elicits numbness or tingling in the median nerve innervated digits. While physical tests are useful, they are not definitive and are often supplemented with diagnostic testing. A nerve conduction study assesses the function of the median nerve by measuring its conduction velocity across the carpal tunnel. Slower conduction or delayed responses in digits 2 or 3 is positive signs for CTS. Electromyography EMG evaluates the health of muscle innervated by the median nerve, such as the abductor pollicis brevis. Abnormalities in motor unit action potentials or increased spontaneous muscle activity confirm a positive diagnosis. Treatment options for carpal tunnel syndrome range from conservative methods such as wearing a wrist brace to more invasive procedure such as surgery. Wrist brace or splinting keeps the wrist in a neutral position, reducing pressure on the median nerve. The American Academy of Orthopedic Surgeons strongly recommends wrist immobilization to enhance patient outcomes. Flexing or extending the wrist can increase pressure in the carpal tunnel, worsening symptoms. Immobilization prevents these movements, allowing the nerve to rest and reducing irritation. Always consult a healthcare professional for a personalized treatment plan based on the severity of your symptoms and underlying causes. Thank you very much for watching. I hope this video helped you better understand carpal tunnel syndrome and how to manage it. For more tips on health, wellness, and managing conditions such as this, make sure to hit that subscribe button and tap the notification bell so you never miss an update.